Tonight, federal funding cuts are impacting a local program meeting the needs of victims of gun violence. The Bullet-Related Injury Clinic, known as BRIC, is one of the groups now losing millions of dollars. New at 10, 5 on your side's Brent Solomon has the group's plea to the public. Brent?
Millions of dollars, Kelly. Support and invest in local groups that are saving lives. That's the message from the director of the BRIC, who tells me they were doing the critical work one day and then the next woke up to news their $2 million federal grant is no more.
After someone has been shot, 50 to 70% of the time, they go to the hospital and get sent right back home.
That's why the BRIC works to bridge the gap. Anyone impacted by gun violence can come to this safe haven for healing.
Whether it was somebody walking home, or a kid getting off a bus, a child who saw a parent shot in front of them, or someone who shot someone else.
Since 2020, more than 200 bullets have been removed from victims of crime.
People can't eat, people can't sleep, people have a hard time moving their body and thinking straight.
Nearly 1,000 people getting holistic care to overcome the trauma. In fact, the BRIC received a federal grant last fall to continue the work around community violence intervention, $2 million. But just last month,
and our account was literally locked like that.
A shocking notice from the federal government.
We got a letter out of the blue on April 22nd saying that we were to immediately stop grant activities because they said that the funding priorities for the Department of Justice had shifted from what they funded us for, which was this healing-based prevention, to more of a law and order focus.
Although the group is putting a freeze on hiring, it won't freeze its mission, being a lifeline when actual lives are on the line.
We were not going to let this break in funding disrupt our frontline service because nothing is more important than that. We're making a call to the region to continue to invest in what it is to have this safety net available to patients who need us most.
The BRIC also receives funding from the St. Louis Office of Violence Prevention, local and national groups, and from those who donate to the nonprofit. It's still hoping to roll out a mobile clinic to take those same services on the road, hopefully this summer.